Platysma band reduction. This is a very popular procedure, and let's talk about how we do it, what does it actually mean, and what are the details of surgery and recovery that go along with that. So first, let's take the term platysma band. What does that refer to? Well, the platysma muscle is a thin sheet of muscle that wraps around the neck, going from the jawbone down to the collarbone. It's part of our normal neck anatomy, and you can actually visualize this platysma muscle by doing a weird grin in the mirror. If you were to pay attention, you'd see bands sticking out, such as what I'm doing right now. There are bands that stick out. That actually is the platysma muscle that is activated, and these bands oftentimes can be apparent at rest, particularly as we get older. The bands become hyperactive and they create bands of skin that stick out. So platysma band reduction is an aesthetic approach where I'm trying to restore a clean jawline, clean neckline, even while animating while that platysma muscle is active. How do I do it? Well, I do it through a procedure called platysmoplasty. Platysma is, of course, the muscle. Plasty means to shape and to mold. Through 3 incisions, one under the chin to get access to the central platysma, incisions behind the ear, sometimes in front of the ear if I'm doing a lower face and neck lift as well, through which I access the platysma by separating the skin away from the muscle, and then I tighten the muscle from the sides to shape and contour the jawline and the neckline, as well as through the under chin incision, getting access to the areas of banding, and I can safely cut the platysma muscle low down so we're far away from those neck nerves that control facial movements, and safely cut the platysma so that there's no more bowstringing, meaning as the muscle contracts, it's not creating a bowstring effect, and that muscle band is disconnected. So by doing a combination of tightening and releasing of those muscle bands, we can get a really beautiful clean jawline and neckline. Recovery is fairly straightforward. It takes about 2 weeks or so to return to a relatively normal appearance. And the result, when it's done correctly, can be a lifetime of improvement.